Hi, today I will discuss the adductor canal. Adductor canal intramuscular space situated on the medial side of the middle one-third of thigh. It extends from apex of femoral triangle to the tendinous opening of the adductor magnus. This is also known as Hunter canal or subsartorial canal. Boundaries anterior, posterior, lateral and medial. Anterior anterolateral boundary is vastus medialis. Anterolateral boundary is this muscle is vastus medialis. Posteromedial or floor adductor longus and adductor magnus muscles posteriorly below. Medial wall or roof is formed by sartorius muscles and subsartorial fascia. Behind or below the sartorius muscles, there is subsartorial plexus of nerve. Lies under the sartorius muscles, formed by the branch of the medial cutaneous nerve of thigh, saphenous nerve, anterior division of obturator nerve. Now I will discuss the content of adductor canal or Hunter canal. Femoral artery. Enter the femoral artery in the canal. Enter the canal of the apex of the femoral triangles and give the muscular branches and descending genicular branches. Femoral vein lies the posterior to the femoral artery in upper part and lateral to the femoral artery in lower part. Saphenous nerve cross femoral artery anteriorly from lateral to medial side. Nerve to vastus medialis lies lateral to the femoral artery. Branches of two division of obturator nerve anterior division emerge at the lower border of adductor magnus and posterior division run on the anterior surface of adductor magnus. क्लिनिकल सिग्निफिकेंस है एडक्टर कैनाल ब्लॉक में यूज कर सकते हैं, यूज फॉर नी सर्जरी और ब्लॉक ऑफ सेफेनस नर्व. फेमोरल आर्टरी एसेस के लिए बेस्ट होता है. डिजिटल फेमोरल आर्टरी कैन बी अप्रोच इन दिस कैनाल. थैंक यू. प्लीज फॉलो, सब्सक्राइब एंड शेयर दिस वीडियो.